kind of listen, what are some of the big issues you're seeing? What's your experience? What are you living?
Yeah, so I've been working in emergency medicine for just coming around to 34 years now. I started out in family medicine before I went back and did my EM. So I did a bit of rural family medicine in Alberta. I've been primarily at the Rocky View Hospital for the last 20 years. We see 250 patients a day in our ER. We have 18 emergency shifts per day. We've had staffing issues in terms of nursing staff. At 10% of our beds were closed during most of COVID just because they needed staff elsewhere. And so out of the 52 beds that we have, we usually end up operating on a 40-bed unit, end up in a situation called bed block. We can't see people, not because we're not available. Nobody's getting discharged, and there's not even a chair in a hallway somewhere.
How are you finding access back out to family physicians?
We're lucky if 40% of our patients will have a family doctor. It's a lot of times if things don't get better, come on back to the ER. We have very limited family physicians still doing regular family practice. It's quite difficult. Do a good job and keep people healthy is definitely stressing out the system. We're definitely at capacity all the time. We're as busy at 3 o'clock in the morning as we are at 3 in the afternoon.
The volumes, the complexity, and just the kind of extent of disease that you're seeing in emerge now, how would you say that looks now compared to even a couple of years ago? And
for complexity, medical problems you're dealing with, stabilization of patients you never would have thought you were responsible for. Most physicians want the patient package. The lab work, get an internist to come and see them. The IV insulin is running and the imaging doesn't show something abnormal. You're not getting a consultant. We've been battling the same kind of resource issues for a long time. Like even going forward, we've more patient care spaces. We certainly need more oncology services. Really, it's always been a capacity issue. Basically, we're dealing with around 2,000 acute care beds. Back in the 90s, we've got the same number of acute care beds here 30 years later, and the population's triple. We are the urology center for Southern Alberta and the ophthalmology center. Where you run into more problems is when you get into specialized surgery, so that may be 2 or 3 months. Sometimes they get refused. We run into that. Time delay is certainly what gets thrown at us a lot of them.
What might you be looking at in the waiting room?
So it's growing and growing. 8 hours, 6 hours, 8 hours, really hard when you just can't move. Time delay is huge. Even cancer surgery are waiting far longer than they should for treatment. I can't get a CT scan done. I can't get blood work done. Can you guys, push them through the ER?
And around for emerge wise and recruitment and how you've been finding that?
We're kind of lucky because people like to come in and work in our ER. So from a physician point of view, we haven't had any troubles with recruitment. What seems to be happening, what I see locally, people don't want to do family medicine anymore. They're taking the extra year looking for a job in emergency. I really appreciate that you're going out there and trying to get the story in. It's at least somewhat encouraging that maybe there's a chance we'll move forward.
I'm hopeful. I got to be hopeful, optimistic that we can make it.